Thank you all, and welcome to day 2 of our Innovators Challenge demo sessions. I thank you all for attending. Yesterday we packed this room so full, our biggest complaint was people couldn't get through the door. So if you're here early, grab a seat now. I have a feeling we're going to fill up again today. We learned a lot from the sessions we did yesterday. Hopefully our technology will work a little more smoothly this morning. So without taking too much time, I will just leave you with 2 quick announcements. After this session is a networking break, and I know there are some sponsored sessions going on. We have a very full program, and it is likely we will run a minute or 2 long. I and the demo presenters would really appreciate if you could hold the mass exodus until after we really wrap up the last one. There's, as I said, there's a good long networking break outside, so there's nothing to really rush off to. And with that said, we thank you for coming once again. Thank you for your patience as we work through our now second session of this. We're going to do a rapid fire format. You get a little ping pong back and forth from stage to stage. We have a lot of companies with a lot of interesting things to show you today. So without further ado, I will turn this over to our moderator of the day, Dr. Julian Goldman.
Thank you. Thank you very much. Good morning, everyone. Good morning. All right, this is almost like the Gong Show without the gong. For those of you who remember, Hi.
I'm not first.
Oh, good.
I don't look like whoever's
I thought I just didn't have enough coffee already, too. Over here is Mike Robkin sitting down. We're going to be both helping to keep things moving. And standing at the podium over here is Dr. Sandra Elliott. Is that right?
Not doctor. I only play one.
Play one on TV. Okay, so you are Sandra Elliott.
Yes.
That's Sandra Elliott, Corporate Director of Consumer Technology and Service Development for Meridian Health and Impak Health.
Correct.
All right. Well, I'm going to let you speak, and I'll get out of the way.
Thank you, everyone. We know this is a very rapid-fire presentation format, so we did leave out a QR code. So if you want some more information or have questions, feel free to check out the QR code. That'll take you to our website, or feel free to ask us right after the session. SleepTrack is just one device of Impak Health's portfolio. You'll learn more about the portfolio on the website, but it's really about focused development on easy-to-use, extremely low-cost, consumer-focused applications. So we're going to show you a quick video demo.
I've been experiencing a lot of fatigue. I mentioned it to my doctor, and he suggested that I try to analyze the sleep that I've been getting. In order to do that, I've decided to use a new product called SleepTrack. Not only is SleepTrack inexpensive, it's easy to use. You simply place your phone over the SleepTrack card and start recording. Once the SleepTrack card is activated, you simply place it in the armband, put it on your arm, and you're ready for bed. And the SleepTrack device is so comfortable you don't even know it's there. In the morning, you simply remove the armband, take out the SleepTrack card, and place it under your phone. Now that the phone has uploaded the data from the card, this is how easy it is to review last night's sleep journal. You can review a summary that shows your sleep efficiency, how many times you awoke during the night, the total time sleeping versus the total time you were in bed. You can also review your sleep history. It can show different days, show a graph of your sleep efficiency, sleep time, your awakenings, a sleep symptom history, and also your stress index. Another function is all of these results are easily emailed. The SleepTrack system includes a daily diary. In the evening, SleepTrack will ask you, did you have trouble falling asleep? Trouble staying asleep? Did you wake up gasping for air? Did you wake up from snoring, or were you told you were snoring? Or did you sleep just fine? This is what your SleepTrack package includes. You'll get the SleepTrack card and your armband. Thanks to SleepTrack, I can monitor my sleep over a period of days or even weeks, and then I can share that information with others, including my physician.
And that's it in a nutshell. I think that there are a couple of things that I want to focus in on. The technology that's involved in the phone reading the card in the device is NFC. I think many of you probably have heard of that, the Google Wallet. It's leveraging a very low-cost, low-power consumptive communication technology. It's very, very low on the wireless spectrum, and it's extremely secure. I think that's one thing that's very important. The second thing that I would mention is that the price point at a consumer level, this is very, very much meant to not be diagnostic, but be more of an assessment and a tracking device for patients to understand what's going on with them, and then also have that a very different kind of conversation with their physician if they're seeing that they can't actually improve their sleep on their own with regard to sleep hygiene-oriented things. The price point is $29, and it's a very easy-to-use device. And again, we thank you for letting us be here, and I'll turn it over to the next person.
Thank you very much, Sandra. Next, we have a presentation by Dr. Nick Van ter Hayden, who is a doctor. And let's see, you're the Chief Medical Information Officer for Nuance Communications, Inc., and I'll let you go ahead and explain what you're going to be showing us.
Thank you very much. Good morning, everybody. For those of you that saw Rosalind Picard's presentation, I wish I was wearing her sensors right now, because I watched the presentations yesterday. There was a lot of learning points in terms of what works and what doesn't. My name's Nick Van ter Hayden. I'm the Chief Medical Information Officer with Nuance. And Nuance is most well known for its speech recognition technology, Dragon in particular. I'm going to present to you the Nuance Healthcare Development Platform, which we launched earlier this year. We now have well over 200 partners that are trying to integrate speech into their applications, and I hope I'll be able to show you some of the reasons why that makes sense in certain instances. Fundamentally, speech is an enabler for applications in the mobile world. There's many of you with tools out there, you're trying to type, and sometimes it's just easier to voice what you're trying to capture in terms of the patient's story, and I think we've heard that repeatedly through the presentations over the last day. The platform is designed to be easily integrated. It's 3 lines of code to include in an application. It's cloud-based and represents, in terms of a live demo, one of the most challenging aspects, because this is probably the deepest point surrounded by concrete and steel that prevents wireless signals. So if the demo works, great. If it doesn't, I've got some backup slides, because I learned that from yesterday too. The application I'm going to show you is a lookalike EMR. It's not a real EMR. It's just something for us to show the integration capabilities. From a clinician standpoint, we can offer the capabilities to dictate into any field, so we can voice enable a field. And I can do that with the Dragon option up in the top right, or indeed, I can just slide to the right in a field, and it's already enabled. And of course, it's picking up everything I'm saying. So patient complains of chest pain. Oops. As I said, always the challenge of live demos, so I'm just going to get right into the demo here. Patient complains of chest pain, crushing in nature, radiating to the right arm. And my connection seems to have died, because although it feels like it's connected, it clearly isn't, as you saw from my message. All right, I apologize for that. Let me revert to my presentation, and we'll go to the slides. I have a few slides that just cover this. So conceptually, we have an EHR. We enable that with a easy-to-use slider. It's 3 lines of code for an application developer, and it links to our cloud-based technology. It returns content directly into those fields. It can be field aware. It uses all of the commands that you're probably familiar with speech recognition technology in the Dragon applications that you see on Macs and PCs, and allows physicians to document the narrative directly into each of those individual fields. From a standpoint of what we're trying to offer, we see the capability of capturing information anywhere, anytime, any place, using voice where appropriate, understand it, and then use it for good. So we interpret that information, as you've seen with Dragon Go and obviously with the Apple Siri product that's created a lot of interest. Speech in our world is the key to mobility enablement. It allows you to offer your customers flexibility in capturing all of the information without the challenges of using the keyboard. You can find more information, you can see videos. Sorry the demo didn't work. I can tell you it worked 1,000 times that I've tried it prior to this.
We believe you. Thank you very much, Nick. Our next presentation will be by David Berkowitz from the Laboratory of Computer Science at Mass General Hospital, where he's the lead technical architect for iHealthSpace project. Please go ahead.
Thank you. Good morning, everyone. As you heard, I'm David Berkowitz, and I'm the senior technical architect at the Lab of Computer Science, which is at the Mass General Hospital. And it'll be my pleasure this morning to introduce you to iHealthSpace. So what is iHealthSpace? On one level, this is a web-based application that patients and providers and researchers can use to connect with each other. And on another level, it's a platform that deliberately supports relationships through the clustering and grouping of people, content, and applications. So why is this important? As you've heard throughout this conference today and yesterday, one of the key challenges we face is the fragmentation of care. And we believe that by bringing patients, their caregivers, and available resources together in a common space, we can help to bring coherence to patient care. So in iHealthSpace, relationships matter, and that these relationships can be used to bind patients and caregivers into meaningful groups. They can occur at different scales and involve not only people, so patients and providers, but where patients can belong to a practice or they can be linked through common diagnoses, but they can also exist in a way between people and resources. So this is what you see when you log into iHealthSpace. And what we've done here is to add in the usual PHR elements, which you can see over here, and also some information that may be relevant for this patient. So everybody, this is very timely advice to go and get your flu shot. But what we've also added in, and what we're starting to work towards here, is the management of the relationship that this patient has with their care team and care groups. Again, you see some of the PHR features, but in addition, you see an example of a bridging application. And this is an application that takes advantage of our plug-in architecture. And this is the Health and Life Balance Plan, which, let's see if it'll show up here. And this is an application that was co-created with one of our practices. And just a quick word about the plug-in architecture. This is an architectural feature that allows application developers to use whatever technology they wish and enable users to have access to it through iHealthSpace. So the Health and Life Balance Plan supports shared goal setting and tracking, and here we see it in the provider's electronic medical record, where during a patient visit, the patient and the provider can begin to create goals in the office. In this view, the patient is now at home, and they're seeing those goals that were set, and they can review, edit, and track this information at home. In addition to the delivery of applications like the Health and Life Balance Plan to targeted patients, we also support the aggregation and delivery of content created outside of iHealthSpace. So as you see here, the Massachusetts General Hospital Diabetes Education Program has created significant content on a variety of social media sites like WordPress, Twitter, and YouTube. And we're able to pull in and aggregate this information so that patients only need to go to one place in order to review all the information. So just as a quick revision, a reiteration of the major points about iHealthSpace. What we'd like to do is to take disparate entities and through the forging of relationships, enable the formation of meaningful groups under the umbrella of iHealthSpace. So quick history of the trajectory of iHealthSpace. We went into full production release in March of this year, and we formed partnerships with 2 practices, and we have about 9,000 active users right now. We will have an additional 5 practices join by the end of the year. And what we are doing is forging relationships with researchers who wish to collect information directly from patients, as well as content providers such as the Center for Connected Health, where patients can come to one site to review their data and information.
Thank you very much, David. Next we have Mitch Strobin from HealthOneMed, and Mitch is the Vice President of Sales and Marketing. Here you go. Do you want to use them?
Nope, I'm going to scream. Good morning. Going to make this a little interactive, 9 o'clock, give or take. My name is Mitch Strobin from HealthOneMed. How many sat through Dr. Schrank's presentation this morning? This is what HealthOneMed does. We focus on medication adherence. And Dr. Schrank talked about all the different adherence costs, and one thing that I want to be sure of that we also include is the human element. Not only are there medical, financial costs, but there's human costs to the individual, as well as their family and others around them. It's the social impact. So what are some of the causes of non-adherence? Somebody. They forget. They forget. Woohoo. Anything else? Someone over there, who was it? Anything else? Oh, somebody. We'll save these 2 for later, okay? You have to make sure it's M&M's. You know, what more can you want from a pill dispenser? So what I'm here to talk about is the dispenser pill. This is the DAP. We focus on a variety of things. I know people are staring at the screen over there, but it's also over here. Safety and security. You literally pour the pills in. A lot of devices, you have to do your pre-sorting, your Monday morning, Monday night, Tuesday morning. Now, you pour the pills in. This will do true dispensing. PRNs, pain medications that aren't scheduled. Take them when you need them. Tough to do it with manual methods. Here, you define how many you're allowed the individual to take, how often, and the time frame between dosages. Personalization and connectivity. We talked about, Dr. Schrank talked about the social aspect of adherence. Not only do you have a visual cue and a pre-recorded tone, you can also record personalized messages, up to 8 of them. It can be funny, serious, you can scream, you can play music. You're not supposed to be someone's friend. You're trying to help them adhere to their medication. Everyone has a different trigger that will help them, remind them to take their medication. That's what the DAP does. In addition, there are other types of reminders. Medication reminders are great, but usually in association with other things, like taking blood pressure, blood sugar readings. You set reminders for those types of things also on the same device. If someone is not compliant with their med or basically doesn't take their meds, a phone call is placed to a caregiver or multiple caregivers or connected to a monitoring center. You choose. Capacity. You manage 16 different medications. Importantly, not just pills. Also non-pills. Not everyone only takes pills. Inhalers, injectables, creams, types of medications in this device. Also, because it's just loose pills, high capacity, small device, 2 to 3 months worth of medications. And this is for you.
Full of M&Ms too.
Yeah. So moving on. So I give a couple of screenshots here. What I'm willing to do for anyone is during a lunch break as well as during other breaks, give live demos. So we have different screenshots, but more importantly, our focus is that beyond medication management, we're not focused only on medication. If you can manage your meds, you can do a better job of managing chronic illnesses and, more importantly, take control of your health. That's really the focus. We want you to take less meds, not more meds. And in the environment, what we want to do is really, the patient is in the middle, but really what we want to do is connect it all together and be a piece of the solution, partnering with many different companies, just like Dr. Schrank said today. Thank you very much for your time.
Mitch, if you need more time, if you have M&Ms, we could arrange something. Now we're talking.
Say something illuminating.
All right. Thank you, Mitch, and thank you for the M&Ms in particular. Next, we have Casey Pittock from BlueLibris. Casey is the president of the company, and ready to go?
I think so.
All right.
Just get it up on
we
screen.
have to switch.
Terrific. Thank you. So BlueLibris is a Silicon Valley company that is attacking a kind of interesting issue that a lot of folks are sort of overlooking. There's all this wonderful new mobile technology coming out and mobile apps and so on and lots of fun stuff. The challenge we see is that most of the healthcare dollars are being spent in the population over 65. We all know that in this room. So I don't know if you know these facts or not, but Pew just did a big study on usage of smartphones. And if you look at the data, 11% of Americans over the age of 65 use a smartphone. And it's growing fast. It's terrific. It's great news. And who knows, 5 years maybe that's going to be 20 to 30%. The challenge is that if you look at 70 and above, it's about 4.5%. If you look at 75 and above, it's less than 2%. So all this wonderful stuff is not being used by a lot of the folks spending the dollars. So we thought, all right, well, what can we do to take a look at this? If you have 89% of the folks not using these wonderful technologies, that's about 36 million people in the United States. So what we decided to do is come up with what we call the world's smallest cellular health monitoring solution. And I'll show you here so you can kind of see it. I was trying to think how to easily show it to folks. So I've got my name tag here. You kind of see it in the background of my name tag. I chose a black one so you can contrast it with the name tag. So it's very small, about 1.3 ounces. Very, very, very simple device. It's always connected, always on. It's not dependent on a base station or wires or anything else. Let me back up here one time. We have a lot of complexity on the inside, but yet we try to make it as simple as we can on the outside. So there you can see it, everyone in the back of the room. I know these pillars kind of make it hard to see back here. So as you can see, there's one button, not 2 or 3, there's only one. Simple LED lights to help indicate the status of the device. There's no user manual. There's no hard-to-read screens. It's very simple. Just push your device and interact with your device. Inside is a different story. I'm not going to give you the whole litany of the bill of materials and so on in there, but we have 8 GPS locations that makes for accurate location. There's a powerful speakerphone and microphone. There are 4 sensors inside the device. The accelerometer is the obvious one that you would all be familiar with. There are 3 others. And the combination of this proprietary sensor technology allows us to do accurate motion sensing. And in particular, we can do fall detection. And that's been a hot button for the senior crowd for many years now. So we have that. And we also have Bluetooth, which I'll come back to on the Bluetooth and what that's for. So I've been in the industry a long time. I've been in over 1,000 seniors' homes. And I can tell you, they tend to resist technology. They don't like these things. So the packaging, the design, we tried to make it lightweight, small, simple, attractive, no stigma, any kind of badge of old age with some of the older medical alarm products. And I'm sort of speaking against myself because I was in that business for 16 years and I love it. Made a difference in millions of lives, but it's time to get outside the house. Seniors are active. They're out and about these days, and they're being encouraged to get out. So the key to all this, technology is wonderful, but it doesn't do anything if you don't have that very personal experience. So when you press the button and a call goes through, it goes to our live operator. There's a connection. The operator knows all the information about the individual. It's a very high-touch, very personal experience. Very important to the senior audience. They like to talk to people. They like to know someone's there. They like to speak slowly. They like to have a conversation, okay? Sometimes too long of conversation. We all have, parents and so on. Anyhow, this then is the information that the operators see. Just a quick little glance at that. So as you can see, there's power consumption, the device itself, some of the sensor information going on. Location pops up for the operators. They can see where the person is, and so on. It's all user configurable, by the way, so it can be customized for privacy issues and so on. And the big news is that it does have Bluetooth as well, so it can connect to virtually any Bluetooth-enabled device. So as vital sign monitoring becomes more prominent and prevalent, and as physicians and the healthcare providers promote these different vital sign monitoring, we can transmit all that information wirelessly through our device. It then becomes a health gateway when that market's ready for that. And that is it for now, but there is more in the future. Thank you.
Thank you, Casey. Next, we have James Diaz, who's the founder and CEO of WellBeMe. Pretty good use of a website, I have to say there. Please go ahead.
Good morning, everyone. Just to situate where we are in the healthcare space and what the challenges are that we're working on, we are looking at episodic care and acute procedures and all of the challenges associated with that sort of thing. As you can see here, many of these facts and statistics are familiar to most of you. 53% of recipients re-hospitalized in Medicare, 60 to 70% patients reporting high levels of dissatisfaction with their communication instructions before procedures. Fewer than 20% of patients actually comply with regimens that are given to their doctors by their guidelines. So we thought we'd come into the market, study this a little bit better, and see if we could make the whole process, sometimes the very anxious and process of getting ready for surgeries and coming out of surgeries, more effective and more comfortable for patients. And so this is where we started. We essentially what WellBe does is we make it simple for patients to get prepared for their surgeries, 45 days before their surgeries, and then to the process of recovering it. And while they're doing this, we are measuring their functional outcomes and patient experiences and allowing providers to demonstrate the value of the procedures back to the payers. And essentially also reducing the risk associated with readmission and cancellations of surgeries and things like that, and targeting specific costs and procedures using the data, helping our providers identify where there's cost wastage and things like that, and bringing that down. How we do it is, in a nutshell, we essentially take a clinical pathway for a standard procedure, and we extract the patient expectations out of those things, the things that the guidelines might suggest that patients do or learn, the teaching expectations, for example, and we put it into a checklist. What we effectively have is a checklisting platform, so we can take any content or any of those activity expectations, put it in a checklist. We add to that all the pre-op processing forms, all the things that people have to do. There's a fair amount of that, including, gather information about their medications, gather information about their insurance. All of that is added to it. We mix in the necessary patient education and add pre- and post-outcomes and experience surveys into the process. And then we sort of deliver it. And so through the process of pre-op and post-op, the system, using a series of rules, essentially delivers these checklists, small checklists, things that people are able to handle once at a time. Using sort of just-in-time principles, they get checklists. You're 4 weeks out, these are the things you have to do. You're now 3 weeks out, here's some more things you have to do. And so we take the patients and sort of, instead of throwing the book at them, which is what most of the time happens, they get prepared in a much more systematic step-by-step way. And then the same thing after discharge, we take the discharge instructions and sort of move them through the process of getting them to their appointments, dealing with a number of different issues and questions that they come up with. All of this, of course, as you might imagine, is pulled in to a dashboard, and we allow the program or case managers to watch the whole population of people that are moving through it. We're using this software The system actually right now with hip and knee surgeries, rather large volumes of surgeries that are taking place and a lot of growth expected. So people want higher ways of managing these these increases. And so the program coordinators can actually see what's going on. Last but not least, I mean, we start with the checklists, which, as I mentioned, include the patient education, but we actually have a very Lego set approach to the process. We can add anything, all these different things in there, including a private patient community where people can ask questions and exchange notes and things like that. Let me show you a little bit about what the software looks like. So here it is. This is actually a production environment. I'm going to show you a test patient inside the environment. So Ellen here is already underway with her checklists. This would have been the first experience she had. Welcome to the program. You know, get started. It's certain things that she profiled herself about. She took a preoperative functional outcome score. This is she's in here for a knee replacement. She could decide if she had a caregiver, a personal caregiver that was working with her, say a family member, who she could include into this process so they could help her along in the process. She is now 5 checklists into the process. She's getting ready for 2 weeks into surgery, but along the way she got ready for joint camp. She did a discharge planning survey, the whole series of things that were done in here as well. Okay, thank you.
All right, thank you very much. Next up we have Gail Hamilton, who's a group lead at MITRE. Ready to go? Thank you.
Can you hear me? Okay, today, just get the screen up here. Okay, I'm going to present an open source tool, so it's a little bit different from what you've seen so far, called megcafe.org, and megcafe.org is actually URL as well. So the problem we were trying to solve is the idea that you're getting patient data. It is fragmented across a lot of systems, a lot of different formats, and you know, your typical clinician has to gather data from lots of different sources. So it typically leads to a lot of frustration. So we built an open source system. Okay. Of course, this is a live demo, so of course the resolution isn't great. Wait a second. High-tech solution there. See if it improves it. Ah, that's better. Okay. So what this tool does is it brings in data from multiple sources and visualizes it in one interface. And the data standard we're using is a continuity of care record, which is a CCR, what we call CCR. And that's just an XML standard. So if we get this all looking okay, I guess that'll work. Just going to log in here. And this is built, it's open source, so you can actually download this code. Oh. Okay, so see, live demo. It's built on JavaScript, so it's very easy to develop. So here we have a list of repositories here. I'm only showing one at this point because I'm actually running this off my laptop. So, and if I do a search here, you can see a list of patients. In this case, I only have 2. And this loads in all the data for the patient. So you can see it's a very simple interface. At the top, we have what we call the cover sheet, which shows all the information that you're typically going to want to see about every patient. On the left-hand side, we have various patient-centric activities that you can look up the patient. In this Options tab, we have various things that you can do for operations on the system. Now, the key to this is we want to be able to allow the clinician to compose a patient record. So it's very easy to do. You just drag and drop the what we call widgets into this central pane here. On the left-hand down here, we have about 20. I'm going to give more real estate over here. And as you can see, you can expand more real estate so that you can see more of the center screen, which is the patient record. So we have about 20 widgets down here, and you can see you can display a lot of information about the patient in this record. We have problems, we have medications, anything that's in the CCR document can be displayed here. And these are very nice, and there's medications as well. And you can move around these widgets, so you can make the display. You can edit these, so you can change the title, you can change the color, you can give more emphasis. And when you log out, you can actually save this display. So the idea is the next time the clinician has a interview with the patient, then they can immediately bring up the patient record in the same state that they left it. So, and what this enables is it's bringing in information it's just using a very simple JavaScript framework. So you can actually use this JavaScript framework to build very quickly new functionality. In this case, we have a timeline, so you can visualize all the information in a timeline. So that's it. 4 minutes goes really fast.
Indeed, it does.
I wish I had some more some M&Ms. I just want to say that's our website. MITRE produces some open source prototypes, including Chiron, Pop Health, and MIST, which is an identity scrubber. If you want to find out any more information, you can visit our website, and you can visit any of these URLs for more information on open source tools at MITRE.
Great. Thank you very much, Gail. Now I know what I'll be doing this weekend. Now we have John Feldman, who's the founder and CEO of Applied Pathways. Go ahead, John.
Good morning. Thank you very much. 4.5 minutes isn't a lot of time. I was intending to show you the software, but I couldn't get it to reconcile with the projector. My system requires a slightly higher level of resolution, so I'm going to walk you through some PowerPoint slides, and I'm going to blaze through them. There's a lot of information that needs to be presented. What we're attempting to do in the innovation that we're trying to bring to the marketplace is to fundamentally lower the expense of developing software applications. So what we've done is we've created a visual programming environment that is explicitly designed around enabling a clinician or another domain expert to be able to model very sophisticated rules, so to create ultimately executable algorithms or pathways. And so what we've done is we've abstracted underneath individual icons, and we've borrowed a flowchart metaphor or a mind map or a spring graph as a visual programming capabilities, but icons are abstractions of code that are presented in a visual form, and each icon, once you've created a concept with our technology, is an object, and so that it's reusable and it's extensible, so that you have then this ability to accelerate your development. So once you've created a subroutine like an Apache 2 risk mortality calculator or a Glasgow coma scale, once it's built, and then it's saved and retrievable, and so that the organization who winds up using this technology has an ongoing and accelerating rate of development. When you drag an icon onto the workspace, a properties editor opens up, and you can begin to embed all kinds of content in each individual component. And so industry classifications, hover text, you can characterize it underneath an ontological structure. You can define the data persistency for any piece of information that's gleaned during a traversal of an algorithm. You can identify how long that piece of information is going to be saved. You can associate reference literature. You can embed video. You can embed audio, any kind of media. And the system has a complete versioning control system, so that as you evolve and you need to create extensions for different clients or for different group practices who want to have different pharyngitis algorithms or different workflows, the technology allows you to take those objects and repurpose them and build different kinds of algorithms. So what we've created is a set of tools. Again, we heard this yesterday in one of the presentations about de-skilling. This is where the X Prize people were talking about de-skilling, and this is essentially what we're doing with our technology is we're taking the programming out of this, and that really this is the thought process. So this is why the domain experts are able to work with this technology is that we've abstracted out these different capabilities to interrogate external databases like electronic medical records so that you can pull in information and answer and pre-answer questions as you're doing them. So the objective with this technology is to create executable clinical guidelines and other kinds of pathways so that, and then to be able to publish to virtually any kind of computing platform so that the same algorithm will be able to be presented over an iPad, over a BlackBerry, over over any kind of Android application. It can be presented on a desktop. So it is a completely flexible and open technology and is designed with a whole variety of different use cases to be able to span point of care, call centers, IVRs, you name it, to be able to support things like deep multifactorial analytics. So it has a very sophisticated capability in terms of supporting math. There is a comprehensive publishing methodology around this so that you begin with what's a domain expert creating an algorithm, goes to editors, reviewers, and this is all cloud-based, and so that you're not dealing with the constraints of geography and have the ability to really build a collaborative development process across an organization. The technology was focused on a variety of specific use cases, modeling content and managing content for organizations and reconciling where you have big alternative delivery systems. You have enormous disparity in terms of different information systems, but supporting clinical information support, longitudinal care management, you name it. This is an example of a diabetes care gap analysis that queries an electronic medical record and identifies episodes of care that need to be delivered. So how am I doing time-wise?
I think that's it.
Okay.
Right. If you have, do you have any M&Ms?
No, but I can.
Well, no, that's it.
Okay.
Thank you, John. Our next presenter is Jeffrey Davies, the Director of Sales for Proxense Technologies. Please go ahead.
Thanks for your time today. Today I'll tell you a little bit about Proxense, the company, small history, and then the products themselves and ultimately how they innovate. We were founded in 2005 by an individual of the name of John Giobbi. The technology was originally targeted at the gaming industry with an initial investment from Bally's. The turmoil of the market hit in 2008, and at that point we decided to reorient our company toward the healthcare IT market for various reasons. Today we have corporate headquarters in Bend, Oregon, with our engineering offices in Florida. We are largely based on a foundation of intellectual property. Today we have 44 patents, 12 of which have been issued, specifically in the market applications of obviously healthcare IT, the mobile wallet space where we're spending some time and some money, and then other various applications in the financial services, hospitality, gaming, retail, etc. Our engineering team, which is a significant portion of our company, based in Florida, largely ex-Motorola people, and then subsequently were the individuals that went on to build the infrastructure behind the XM satellite radio organization. So in essence, what is Proxense? Proxense is an open API-based wireless LAN on top of which multiple applications sit and or can be written. So the two products that are deliverable today and installed and working in customer sites are Prox Access and Prox Tracks. Prox Access is basically a device, an automated access device, so that a user who is wearing a badge, which that's what ultimately what it looks like, wears the badge, approaches the PC recognizes who that user is, and upon biometric authentication, they're automatically logged into all of the applications they use. When the user walks outside of the radius of the PC, they're automatically logged out. So how does this innovate? It finally brings balance between a physician's requirements for productivity, efficiency, and throughput against administration's requirements for security. So Prox Access is one of the innovative products. The other innovative product is what we call Prox Tracks. Prox Tracks is ultimately a real-time location systems technology, which many of you have heard of, basically wireless asset tracking. So whether the asset is a piece of equipment, patient, or staff member, the system can track up to the second within 5 feet as to where that particular asset exists. So how does this innovate? Ultimately, on the operational side, when you're tracking equipment, biomedical engineering and nursing is no longer looking for equipment, they're actually using equipment or fixing equipment. However, the real innovation exists where we put the patient at the center of care. When you put the patient at the center of care and you can measure the interaction between a physician and the patient, for example, at the bay level in the ED, you're going to increase charge capture, you're going to decrease length of stay, and even in certain circumstances, you're going to be able to monitor core measures. So ultimately, lowering overall healthcare costs. There are other applications which we are in the process of developing, but candidly, they're not deliverable to yet, which include ProxRec, which to some degree will interface and interact with a PHR, depending upon how that market moves along. Proxtelemetry, which makes the security of our infrastructure important. And then again, this is an open API-based wireless LAN, so other vendors we encourage to develop on top of our platform as well. Thanks.
Thank you, Jeff. Our next presenter is Dr. Michael Yuan, who is the CEO of Ringful Health.
Should I see that on the screen? Okay. Yeah. All right. So my name is Michael Yuan, and I'm the CEO of a company called Ringful Health, and we are based in Austin, Texas. And the patient-centered care has been a cliche recently, but that's really what we do. We help hospitals improve quality. And there are many ways for hospitals to improve quality, we know that, and the patient engagement is one of the best ways. There's sufficient evidence to show that. But engaging patient is also a very expensive and error-prone proposition. You need to hire new nurses, new equipment to buy for the patient to take home, video stuff, and, the monitoring stuff and all that things. And we try to make it easier. So we try to make it more cost efficient by using the technology that people already use and the workflow the nurse already use. And we have multiple pilots in multiple hospitals in Texas, in Houston, and in other places. But in this presentation, I will focus on one of our solutions that for readmission control for heart failures. And here are some of the media coverage that we have, for the company recently. So. As we all know, the readmission control has two key components. One is discharge planning, and the second is patient follow-up after discharge. And this is one of the solutions that we piloted. And as many people here would recognize, those are essentially the CMS checklist that CMS published for the discharge planning. And so we basically took that and, another information hospital provide and make it an interactive guide on the tablet. So we have that. We have one hospital piloting iPads, the other one piloting an Android-based device, and so that checklist there provide a shared screen experience between the nurse and the patient being discharged. They can work on those checklists together and all that. And then there's drug list, which we ask the patient to do the medication reconciliation themselves. So we provide pill pictures, we provide layman's explanation of those pills, things of that nature. And we have them make up appointments, and we have videos in every of those steps so that the patient can understand what's going on. And the purpose of capturing all this on the computer is that then we can follow up, right? So at the very minimum, those checklists and end lists can be printed out, can be emailed to the patient, can be emailed to the clinicians through the NHAN Direct project, through the secure email project, right? And but the drug list and the appointments can be set up for reminder later. So, that's I want to do a live demo, but since we don't have a Elmo doc-cam, this is what you can do. That's if you want to see a live demo of the system, take out your phone right now and text your name, like Michael Yuan, to this number, 31224 heart. And this is one of our projects for, to follow up the heart failure patient. That's the follow-up piece. And, so the URL for this is readmission.ringfulhealth.com. And as you go through the process, we engage the patient through multiple telecommunication channels. So, so once you text that message in, you will get a registration link, and once you register, you will get a daily questionnaire about that's developed by clinicians, and you will you will have 10 questions to answer, and you have vital signs to enter. And the idea here really is to detect early warning signs the patient might have that might indicate readmission. And this questionnaire here we show that delivered on the mobile phone, but it can be delivered over the regular web, and it can be delivered over voice for older patients. And then if you don't finish those, you're going to get reminders, and those reminders again comes in email, SMS, and voice. And so. Now you'd say, this Ringful company can deliver a couple of text messages. What's so special about it? And so The real thing happens when we, our key value proposition is really to stratify the risk by incorporating those factors that has not been captured before. Not only the early warning signs, but also the behavior factors the patient demonstrate by responding to by responding to reminders and their compliance with those things. And then we provide a dashboard for the clinician to look at we incorporate into the existing risk stratification model based on EHR data, and then we provide a dashboard for the clinician to look at which patients are most at risk. And so those are obviously some fake patients. But then, so the idea here really is that it's integrated into existing TCM and CTI solutions for post-discharge management. Thank you.
Thank you, Michael. Next, we have Doug McClure, who's the CTO and VP of Operations of Healthrageous. And many of you know Doug because he used to be part of the Center for Connected Health and Partners. Welcome back.
Well, thank you. It's like Alumni Week, right? Yeah. So thank you very much. Thanks for the opportunity today. So what I want to tell you about is Healthrageous and what Healthrageous is. We are a population health engagement platform. Our job is to figure out how to help you all do a better job at taking care of yourselves, because let's be honest, we're all not doing very good at that, right? So what we have to do is figure out what's up, what is it that you want to work on in your health, and how can we help you get there? Because going to the doctor and having the doctor kind of wag their finger at you and tell you what you should do isn't working, right? So what we need to do is design tools that help individuals work on the health problems that they're interested in and achieve some success around that. And the way we do that is we create engaging tools, right? We have to understand that it's about consumer engagement and then mapping that back into health. So as we look at what Healthrageous is, we are a tool that can be used across the population. We have programs that are wellness-based. We have programs that are activity and weight-based. We have programs that are designed for disease management, hypertension, diabetes, et cetera. This is gives us the opportunity to go on and take on a population from a health insurer or a self-insured employer client and take those populations and stratify them into the right kind of program and to create an action plan, help the individual create an action plan around their health. So if we go through the onboarding assessment process at Healthrageous, what happens is the individual figures out what it is they want to talk about, what do they want to work on in their health, and then we help kind of figure out what is the right program and the shape of that. So the platform is designed to be both customizable in the sense that it can be your Blue Somewheres program, and it is both it is also highly personalized. So it's all about how is it about me and what's up in my life and what's important to me. So across the first year plus of the business, these are our book of business numbers. So if you look really quickly, what you're looking at there is numbers like 97% engagement and somewhere around 20 to 30% of significant health outcomes, right? So as people go down and into our programs, what's happening is they're changing things about their health and they're getting significant outcomes. Reduced blood pressure, much more active. If you want to learn more about that, we have a white paper that we can share with you at our booth. So right as I get ready to go into the quick demo, I want to just share that this is a platform that understands that not all things work for each of us all the time, right? So what we have to do is understand that what drives Doug is games and social contracts with his wife. What drives other people are data and numbers and seeing things. And Doug likes to get things through email because he's sitting in front of his computer all day. Other people live in their mobile phones. So you have to understand, you have to build a tool that reaches out across all these different modalities and creates an experience that is engaging to individuals across them all. And what drives all of that for us underneath is our automated digital coach. This is the logic and the machine learning that figures out how is Doug different from somebody else and what are the tools that are going to help him. So all right, let's jump in really quickly and take a look at the mobile app for today. Our mobile app is available on the Android operating systems, the iOS platforms, including the iPad and BlackBerry. It is an app that reconfigures itself based on what program has been designed by your program sponsor, but also what is it that you're working on? What's your personalized experience? So you can see I happen to be in a program right now that is both dealing with activity and weight kind of questions and also blood pressure, hypertension. So if we go in and we take a look, we can see that today I haven't been very active yet. Yesterday I did a pretty decent job. I got 7,600 steps out of my goal at 10,000. If we go back 2 days ago, you can see it's been a quiet week for me. If we go in and take a look at blood pressure, you can see over time that I actually kind of hang out in a pretty good range. I was out a little bit too late last night. It's been a busy week in terms of work, as I'm sure all of you are aware, and my blood pressure started to go up. What a surprise, right? So this is why we want to take readings on a more frequent basis, because if I showed up to the doctor's office with that one today, they'd start to be worried about my blood pressure. But if you look at how I've been, right, over the last year, I actually don't have that issue, right, thankfully at this point. All right, so real quickly, let's talk about that automated coaching engine. The coach is trying to figure out at any given time what is the right thing to talk to you about, and it's figured out quite well. If some of you may have noticed, Doug's weight is a little high. What he struggles with is diet, right? So the coach is coming back and talking to me about what's a serving size. The platform is designed, as I said, to have gaming components to it, community, et cetera. These are all different mechanisms to help affect behavior change and help all of you do a better job at taking care of yourself. Thank you.
Thank you, Doug. Thank you for making me feel really guilty today. Now Neil Stein, who's the Chief Health and Wellness Officer for Andago. Is that close enough?
Yep.
Okay.
Good morning. Some great presentations, and I'm not sure. I really do like the Healthrageous application, though I don't know I want something telling them my serving size is enough for a family of 4. To start, so Andago is a company based in Spain. We've recently expanded to offices in Cambridge in the UK, Miami, and Panama. And we started in the government space, basically letting people connect with governments, everything from permitting to just basic communications. And through our contacts with the governments, we found there was a real need for health connectivity. And so what we decided to do is build something based on that. Andago's solutions are all open source, as Gail was speaking before about that. So everything we've done is built for interconnectivity. And this was the basic model we started with for the Continuum model. So anybody familiar with Continuum has seen this slide before. And basically, it's an end-to-end solution that brings data from a patient to a back-end central database. So what Andago wanted to do is think about how we can expand that. And one of the things we looked at was taking the ecosystem not just from the patient to a back-end database, but expanding it to all parts of the healthcare infrastructure. So that, in some cases, can include the telecom vendors. It can include insurance companies. It can include, in the States, PBMs. In the UK, it can include GP consortia, device manufacturers, communications providers. They are all now part of the healthcare infrastructure if we're going to do things like connect with the pill dispenser or bring Healthrageous to people. Or I'm wondering if she can sign for New Jersey. To bring all those things to people. So we really look to expand that. So the basic infrastructure is this: a mobile phone or any tablet or any internet-enabled device connected to a cloud. And that cloud is a rules-based engine. So we started thinking about, all right, what should be connected? So really any health device can be connected, any Bluetooth-enabled device. We can do proprietary protocols, but really it's about open source. Because one of the reasons monitoring hasn't been bigger has been the cost of it. And what this does really reduce it. So in addition to the devices, you could do any point of time device like a blood pressure monitor or streaming like an ECG or EKG. And then you also can utilize some of the phone's basic infrastructure. You could do messaging, you can do surveys, but you could also do two-way video chats. And you can also do geolocation. But connected to that, that's only on the one side, on the left, which is kind of the patient side. On the right side of that, in the cloud, you could start to integrate physician schedules for video chats. You can bring in PBM data. You can bring in the drugstore data where you're filling your scripts. You could bring in the hospital EMR, the physician data. But most really exciting to us is the third-party applications. Because while we think we have some good ideas on this, there's a whole lot more in this room and in this conference than we're going to come up with. And we want to be able to incorporate them. So when we think about these third-party services, it's not just about personalized ecosystem, but now we can customize it. And you can customize it based on the individual and based on the person that's actually paying for this service. So think about the other services you can bring into this. Health benefits, PBM, formulary, and copay. You can integrate the flexible spending accounts and the healthcare spending accounts with this. Any kind of other health services you want to bring in, including machine-to-machine communication, because it all goes back to that third, to those third-party programs and the central database. So what Andago will do then is integrate with multiple platforms. Free interchange of devices. So if you're taking your blood pressure, you could use Nonin, or you could use A&D, or you could use any other manufacturer. You are now free from proprietary systems. It's carrier agnostic, and it can work on any internet-enabled platform. Thanks. Good on time.
Thank you, Neil. I think we may have a brief pause here in the sequence. Let's see. Mike McClellan, is that you? Sorry to wake you up.
How we doing?
This is Mike McLeod of Status Solutions. Here you go.
Yeah, right there.
All right, time's almost up.
My time's up?
Just started.
All right. My director of marketing said keep it simple. For a simpleton, that's an easy instruction. So here's our competition at Status Solutions, okay? Ignorance. What we do at Status Solutions is we provide situational awareness. How do you defeat ignorance? Awareness. Awareness is not a product. Awareness is an experience. You experience awareness, okay? Now, CATIE is an acronym for Communications and Access to Information Everywhere. We're a middleware company. We make things play nice in the sandbox, okay? CATIE is actually part of an ecosystem at Status Solutions that consists of an alert server, an inference engine, a video server. This is our media server. We serve up content to screens, and CATIE is an all-screen strategy, okay? We've heard about Androids, we've heard about iPads. We view screens as one of 5 types. Digital signage, which includes televisions, workstations, kiosks, tablets, and handhelds. And there's a little blurring of which bucket is which, but all the stuff you've been hearing about has to be delivered. You have to get the content delivered. CATIE is, I'm going to make some sweeping generalizations here, and generalizations are by definition partially false, but this product was inspired by my 84-year-old mom and my 22-year-old daughter. My daughter's an RN. My mom is a senior. Does anybody here know any seniors? Anybody here have any parents? Okay. This product is targeted initially at the back to the dorm crowd. Okay. Those people who want to be around people of their own, socioeconomic standards. It's the continuing care retirement centers is initially where we're targeting that. I've got an example running in front of you. Okay. Why do you use a kiosk? Okay. Why do you use the ATM? Do you use the ATM because you think the technology is cool? Or do you use it because you think the cash is cool? Okay? People are going to use technology because of the outcomes. Okay? What we're driving, all these things you've heard about, they're trying to drive outcomes. But you have to first surmount the difficult reality. 2 out of 3 seniors are not E. Okay, you can't use E-Trade, you can't use eBay, you can't use e-commerce. Seniors have what I refer to as E-Squat. Okay? First, you have to make them electronic. You have to give them a user interface. It's a very fine line between the people who left the workforce pre or post Bill Gates. And their screens do not freak seniors out, keyboards do. Okay, period. Okay? And so you got to give user interfaces that allow people to take advantage of all this cool technology. That's what we do at Status Solutions, is we serve things up in appropriate user interfaces so that people can get utility out of them. How am I doing on time? I got a minute to go. If you take nothing else away from any of this, is the why trumps the what and the how. Our world is this big. If it was 90 degrees in here, Is that helping anybody's health? If you're ostracized and you're on the wrong side of a digital divide and you can't even get email from your granddaughter, I mean, we're not going to change granddaughters. We're not going to change grandsons. They're not going to write letters. They're going to tweet. They're going to text. They're going to Facebook. Look at this as granny book. Okay, let's get these people electronic so they can do the health monitoring. That thing combines the power of a tablet PC and a web server and an email server and an IP telephone, and it's a portal. This is a portals and dashboard strategy. If I want to do my health monitoring and all my telemedicine and telehealth and have virtual doctor visits and all, I got to have portals first that people will actually use. That's our contribution to society. Thanks.
Mike. Our next presenter is Mark Decker, Vice President, Sales Operations for AirStrip Technologies.
Last speaker, and I have to observe sitting out there watching everybody. Pretty exciting time to be in this space. I think everybody'd agree. A lot of really interesting dynamic technology. What I'm going to introduce briefly is a company based in San Antonio, AirStrip Technologies. We were founded in 2004 by Dr. Cameron Powell. Some of you may have seen the Apple ads that have been running recently where it shows the word critical and then you see somebody scrolling through waveforms. That is us. We were founded in 2004, released our first platform shown here, which is AirStrip OB. Founded by an OB. He was delivering babies at 3 different hospitals in San Antonio, and his co-founder, Trey Moore, developed a platform to mobilize critical data. So what I'm showing here is a demo of a fetal strip on top, contractions on the bottom. He at that time, was able to use a BlackBerry to track his patients. We've since evolved into the iOS platform, Android platform. Our mission is to mobilize every piece of critical data to an agnostic device, regardless of the equipment throughout the enterprise and what the physician and caregiver is carrying. That is what we will enable the caregiver to see. This was launched in 2007. We have about 350 installed sites, some of the largest IDNs working with us currently. In April of this year, we moved to kind of a second sector, if you will, of dynamic caregiving, which is heart management, STEMI care. So what we've been able to do is provide the physician care team, nursing team from a STEMI initiative, patients on the rig. 12 lead is being done. Current workflows are such that many of the physicians receive faxes from the ambulance. So they're trying to diagnose off an 8.5 by 11 piece of paper. What we're able to give them instantaneously from the rig is a 12 lead given to their mobile device, iPad, iPhone, Android. So they're rendered with a real-time 12 lead, okay? So you've got immediate consultative network going on, ED physician, cardiologist, maybe an EP physician, depending on the severity. They can drill deeper into that waveform, and they're able to scroll and see a full 10-second recording. So with this is a reduction in false cath lab activations, time is heart muscle, so the patient is able to be diagnosed much quicker. The next platform that we'll be introducing, released later this quarter, is what we call AirStrip patient monitoring. So we're servicing the OB sector. We're now moving to cardiology, which is expanding within the enterprise, still fairly departmental in nature. Now what we're going to be able to do is provide mobile surveillance across the enterprise. You will get a series of labs, meds, I's and O's, allergies, but what is very, very critical and what we're doing as a FDA-approved company is providing the waveform. This is not intended to be a 24-hour surveillance. This is not a bunker tethered type surveillance that you're seeing in the EICUs. This is servicing the physician that's on the move, in and out of the hospital, the caregivers moving around, and this provides them untethered surveillance. Okay? Thank you very much.
Thank you, Mark. Come a long way. Next and last presenter is Marlene Begelman. Dr. Begelman is the CEO of Enhanced Medical Decisions, Inc.
Thank you. Good morning. Recently, we received an email from a frantic young woman. Her boyfriend was on a rig off the coast of Mozambique with the worst headache of his life and fevers of over 105. The medics had no idea what was going on. This young man had been in excellent health, but had received some medications a few days before. We entered these meds into our software. Within seconds, it diagnosed a rare vaccine reaction with a high likelihood of death without urgent action. With the compelling information in hand, the Coast Guard quickly flew him to the mainland where he had access to a respirator that he needed to survive. The young man is alive because of his girlfriend's resourcefulness and because of ready access to information. There are more than 100,000 inpatient fatalities every year due to preventable medical errors. Many of these could be averted by information access. At Enhanced Medical Decisions, we've spent the last decade creating a technology that we believe will be among those that transform the way that medical care is practiced. We combine natural language processing and expert systems to read and analyze reams of information within seconds to quickly assess time-sensitive situations. Our system retrieves information from a wide variety of sources, from electronic medical records to original scientific literature. Our mission is to inform decisions, as well as to automate documentation to liberate caregivers from the tyranny of data management. During this brief window of time, let me see if I can convey through examples how the system works. This is the dramatic Coast Guard case. Our engine scans thousands of pages of medical knowledge in an instant and retrieves the passages that match the patient's drugs and symptoms. The correct diagnosis is highlighted in yellow. Here, the engine extracts data from electronic medical record to automate patient problem list creation, an important meaningful use task. To achieve accuracy, the engine considers each phrase in its context within the sentence. For example, the term pulmonary embolus is used twice. The instance highlighted in black is recognized as a differential diagnosis term and is excluded. The one in green, in contrast, is tagged as a problem and included, simulating human language understanding. In this example, the engine maps medical terms to ICD-10 and SNOMED codes so that data can be shared among entities using different coding systems. The engine goes beyond the usual approach by recognizing varying degrees of relatedness between the terms. Mapped results are broadened or narrowed based on the context in which they'll be used. The level of precision in mapping is important since it will determine the usefulness of the decision support. In this example, the engine is aggregating complex information from scientific literature to create a reference source for physicians. Curating this knowledge manually is costly, error-prone, and riddled with information gaps. In conclusion, computers don't replace physicians, but the information that they provide is indispensable for safe care. Curating this, especially as care is increasingly complex and hard to and difficult to track. Information technology has finally reached a stage of maturity that will support our futuristic visions of the possible in healthcare, including instant access to knowledge when it is needed, a broad and deep understanding through outcomes data of which care works and for whom, and automated round-the-clock monitoring for errors and oversights, to name a few. We are on the verge of an IT explosion in healthcare that many years of work and perseverance among the people in this room and beyond have made possible. Thank you very much.